Hello, this is Kim Jong-il. Today, we will look at retrusive control in non-extraction treatment. In particular, we will focus on the location of the premolar. Where should the mandible be located when the maxillary first premolar erupts? Should it goes to number A or B? It needs to go to number B. So where should the lingual cusp of the upper premolar be located? It should be located on the distal side. In other words, in the picture, the upper teeth should move backward and the lower teeth should move forward. How do you treat Class 2 malocclusion? Many doctors use mini screw. Using a mini screw, the labial inclined lower anterior teeth are uprighted and the upper anterior teeth are moved posteriorly. In particular, they try to retract the upper anterior teeth as far as possible. Is there really only this method? Another method is to move the upper anterior teeth posteriorly and to move the lower premolar teeth anteriorly. Would the craniofacial complex be changeable or unchangeable? If the craniofacial complex is unchangeable, any orthodontic treatment methods may be okay. In other words, you can use a mini screw to retract the anterior teeth of the upper and lower posteriorly. On the contrary, if the craniofacial complex is a changeable structure, what will the condyle react to when the upper and lower anterior teeth are retracted posteriorly? The condyle is moved posteriorly, and the disc is likely to come out anteriorly. The craniofacial complex is a changeable structure. How should we treat it? It is desirable to carry out treatment in which the upper teeth are moved posteriorly and the lower teeth are moved forward. Therefore, you may be able to improve the condylar or disc relationship that was under pressure. The required adjustment is referred to as retrusive control or retrusive guidance. The lingual cusp of the upper first premolar should be located in the distal fossa of the lower first premolar. However, it is not easy to observe the palatal side by taking an impression every time in the clinic. Therefore, it is important to look at the buccal side in clinical practice, and the L4 cusp tip should be located at the U4 mesial marginal ridge. To do this, the upper anterior teeth must be moved posteriorly, and the lower premolars must be moved anteriorly. In non-extraction treatment, retrusive control should be applied from diagnosis and strategic leveling. First, make a Class 1 canine key and check the relationship between the L4 cusp tip and the mesial marginal ridge of the U4 to make a desirable premolar relationship. If it's hard to get a good premolar relationship, at the finishing stage, the palatal cusp of the upper first premolar should be positioned on the distal fossa of the lower first premolar. A magic triangle means that the upper canine is located between the lower canine and premolar. Lower premolar should be placed between the upper canine and premolar. These two conditions must be satisfied before removing the brackets. In the previous lecture, the location of the canine key and premolar was important as an additional 3 keys for strategic bonding. The occlusion shown in the picture is called half Class 2. In the case of half Class 2 for treatment, the upper first premolar should be located posteriorly, and the lower premolars should be located anteriorly. In order to move the upper first premolar to the posterior, use an open coil spring on the upper canine and do a tight cinch back. At this time, do not attach a bracket to the upper second premolar. Then, apply force to the tooth 6 area of the lower using an open coil spring so that the lower premolars can move forward. For more accurate retrusive control, You can use an open coil spring on the tooth 5 area of the lower as shown in the picture. Then, the lower first premolar moves forward, and the upper first premolar moves posteriorly so that a Class 1 canine relationship and desirable premolar position can be obtained. When this position is determined from the left and right, the orthodontic treatment can be easily completed through the steps of aligning and finishing. These teeth are called winging teeth. The right side is Class 1, but the left side is half Class 2. In the case of half Class 2, should the lower second premolar be located in the anterior or posterior? It should be located in the anterior. To move the lower second premolar forward, use an open coil spring on the tooth 6 area. First, to solve the winging teeth, align the anterior part by using an open coil. Spring length is about half the width of the bracket between incisors. Then, by using an open coil spring on the lower tooth 6 area, you can achieve two effects at the same time. That is, 1. Derotation and uprighting of the lower second molar. A desirable premolar relationship can be obtained. In the case of occlusion of full Class 2 or half Class 2, it is recommended to attach brackets to teeth 1, 2, 4, and 6 first for upper. The picture above is a full Class 2 case, and the bottom is a half Class 2 case. This patient is in full Class 2. I first use a twin block to move the mandible forward. Then strategically attach the brackets. You can see that the mandible has a severe curve of SPE. Since the lower second premolar is still less erupted, use an open coil spring on this part without attaching a bracket to teeth 5 and 6. Then, as the curve of SPE becomes flat, you can see that the occlusion has almost changed to a Class 1 relationship. If you finish with Mio, the treatment will not be difficult. Therefore, full Class 2 with large overjet case can use twin block first. This patient is recommended to treat as non-extraction as possible because the overjet is not large and no crowding in the lower. On the right, the upper canine is located in front of the lower canine, full Class 2, and the left is half Class 2. Where should the upper premolar be located? It should be located on the posterior. There is some crowding in the upper anterior teeth, but it is not severe. In this case, is it better to attach a bracket to the canine first, or not? It is better not to attach it. Using an open coil spring in the canine area, move the upper first premolar posteriorly. 1 month after using the open coil spring, you can see an improvement in the premolar relationship of the half Class 2. On the other hand, on the right there was not much improvement in the premolar relationship of the full Class 2. At this time, do not attach a bracket to the upper second premolar. In the upper, attach brackets to teeth 1, 2, 4, and 6 first. TPA was used to maintain the second premolar space, but I don't use it now. Then connect the power chain by attaching a lingual button to the upper teeth 4 and 6. On the left side of full Class 2, put a composite resin on the mesial fossa of tooth 44. Let's review it again. Where should the lingual cusps of the upper first premolar be located? Should it be located on the mesial side or distal side? It should be located in the distal side. Bracket bonding was first applied to teeth 1, 2, 4, 6, and open coil spring was used on the canine area. At this time, engage the 0116 SS arch wire with tight cinch back. What will happen? The upper first premolar moves posteriorly, but the lingual cusp may be located mesially. It is not good for the lingual cusps to be located on the mesial side. To solve this problem, attach a lingual button to the lingual side of the upper teeth 4 and 6, and then connect the power chain between the buttons. How will it be moved? The lingual cusps of the upper first premolar will move distal, and the lingual cusps of the first molar will move mesially. This improves the class 2 relationship as the upper first molar rotates distal parallel rotation. In the case of full class 2 and half class 2 like this, please remember that brackets are first attached to teeth 1, 2, 4, and 6 for upper. As on the right side and the left side, you can see that the canine key is class 1, and the premolar relationship is also normal. Leveling the anterior teeth for lower and using an open coil spring on the tooth 6 area with 0.16 any tie. After that, attach the bracket to tooth 6 and finally insert Mio with short class 2 elastics to finish the treatment. In Mio, the treatment process is relatively simple. However, rather than the process of treatment, you should think about the reason why you do this treatment. It was diagnosed in January, and the relationship of the upper canine and premolar has improved by strategic bonding from February, and I waited for the lower second molars to erupt. The treatment period took about 1 year and 2 months. The figure is a case of full class 2 canine relationship. If the overjet is large, I use the twin block first. It is best if the canine key is improved to a class 1 relationship by using a twin block, but it is okay to improve it to a half class 2 relationship. Even if it is half class 2, it will improve the premolar relationship by strategic bonding. If the anterior movement of the mandible and the posterior movement of the maxilla are insufficient despite strategic leveling, put a composite resin on the mesial fossa of the lower first premolar. In the case of full class 2, half class 2, and normal overjet, attach brackets to teeth 1, 2, 4, and 6 first. The initial arch wire is 0.14 Nt. Then, in the 0.16 SS arch wire, do a tight cinch back while using an open coil spring on the canine area. Next month, activate the open coil spring. Attach the lingual button to the teeth 4 and 6. Solve the canine relationship. After that, attach a bracket to the canine. Align anterior 8 teeth and use an open coil spring on the tooth 5 area. Composite resin will be discussed in more detail in the next retrusive control part. The lingual cusp of the upper first premolar should be located in the distal fossa of the lower first premolar. To do this, put a flowable resin on the mesial fossa of the lower first premolar. When the resin is placed on the mesial side of the lower first premolar, the lingual cusp of the upper first premolar comes down and touches, so that it is located in the distal position. At this time, if you attach a lingual button on the lingual side of tooth 4, 6 and pull it with power chain, the lingual cusps of the upper first premolar will move more distal, so treatment is easier. This patient came to our hospital after being treated at another dental clinic. He came to the hospital in June and said he was going to study in Sweden 1 month later. The midline is deviated to the right. The left canine relationship is good, but the right one is half class 2. This is because the teeth were moved backwards to close the remaining space in the lower. A month later, I finished the treatment and removed the bracket. What have I been doing in the month? Temporary prostheses were exchanged for permanent prostheses before going to study abroad. You can see that the canine key has become class 1 relationship. I put a resin on the mesial fossa of the second premolar so that the lingual cusp of the upper premolar can be located in the lower distal fossa. The posteriorly positioned mandible moved slightly anteriorly, resulting in a matched midline. It would have been better if the lower posterior teeth were uprighted using Mio at this time. However, in the case of this patient, the treatment period was limited. The half class 2 was easily resolved by putting a composite resin on the mesial fossa of the lower second premolar. By placing the resin on the mesial fossa of the lower premolar, it induces the lingual cusps of the upper premolar to move to the distal. Look at this case. The finishing is not working well. Why doesn't it work? You can see that the lower teeth are shifted to the right. Looking at the location of the lower first premolar of this patient's right side, it can be seen that the first premolar has almost no lingual cusps as shown in Figure A. If the shape of the lingual cusps of the first premolar was as shown in B, it could have been easily improved to a Class 1 relationship. How should it be treated? In this way, when the composite resin is placed on the mesial fossa, the distal cusps of the maxilla touch it and are located in the distal fossa of the lower premolar. Let's review the retrusive control in non-extraction treatment. You should think about diagnosis and strategic leveling first. You need to remember the Class 1 canine relationship and Class 1 premolar relationship. Many doctors value the Class 1 canine relationship, where the upper canine is located between the lower canine and the premolar. However, it should be remembered that not only this, but also the location of the premolar is very important. That is, the cusp of the lower premolar should be located at the mesial marginal ridge of the upper premolar. For this, the lower premolar must be located in the mesial, and the dentition of the upper must be moved posteriorly. Finishing treatment is easier when a desirable premolar relationship is achieved during the leveling stage. If the premolar relationship is poor during the leveling phase, Mio should be used during finishing stage so that the palatal cusp of the upper can be placed in the distal fossa of the lower premolar. In other words, it is important to make a Class 1 canine relationship or a half Class 2 canine relationship from the leveling phase. Thank you for watching.